Dr. Michael Bookhardt. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances. Visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today, and remember, true wealth begins with good health. Hello, I'm Dr. Michael Bookhardt. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today, and remember, true wealth begins with good health. Hello, I'm Dr. Michael Bookhardt. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly. Welcome to Telehealth Tuesday, your go-to podcast for insights on modern healthcare and wellness solutions. I'm your host, Dr. Michael Bookhardt, and today we have a very special episode lined up for you. We'll be exploring the world of maternal and family care, and also tonight we will be looking at the world of dentistry with our guest, Dr. Deidra Snell. Before I go into her bio, I want you to know that Telehealth Tuesday can be viewed on multiple platforms, including our YouTube channel, Dr. B TV, and Good Faith Wellness Center, Instagram and Facebook pages. Please follow, like, share, and subscribe to help support this program. Dr. Deidra Snell is a native of Port Gibson, Mississippi. She holds dual BS degrees in biology and biochemistry from the Alcorn State University. She has participated in research at Andhra University in India, Johns Hopkins School of Medicine, and interned at the Grand Gulf Nuclear Station. Dr. Snell earned her dental degree from the University of Mississippi Medical Center, where she also completed a general practice residency. She has been on 10 dental mission trips to Central and South America, and serves on the boards of Salt and Light Ministry and the Mississippi Sickle Cell Foundation. Dr. Snell has experience in corporate dentistry, mobile dental units, community health centers, and now she owns Ridgewood Smiles Dentistry in Jackson, Mississippi. Additionally, she works weekly in Louisiana at various nursing homes and also mentors dental students as an off-site faculty member for UMC School of Dentistry. Family and friends, please welcome to Telehealth Tuesday. Welcome to the show, Dr. Deidra J. Snell.
Thank you. Thank you for the great introduction, and blessed to be here and honored to be asked to be on.
Absolutely. How are you feeling this evening? How was your day?
It was a day, as always. You just get whatever you get and go with it. Whether it's busy or whether it's slow, we just gotta take what's ever thrown our way and make the best of it.
Yeah, absolutely. Absolutely. We're broadcasting here, ladies and gentlemen, Telehealth Tuesday from our mobile site. And so we are on the road. We have taken this show on the road, but we are so grateful to have Dr. Snell with us. Well, let's get right into it. I'm going to make sure we can monitor with our comments here. We're seeing a few folks have joined us. Thank you all for that. Please, and don't all ask at once. Please feel free to go ahead and submit your questions and comments or even concerns right here. We are live. So let's get right into it, Dr. Snell, shall we? I love those glasses, by the way.
Oh, thank you. Thank you.
I love that. So tell us, how has in-person dental care evolved in the city of Jackson, when it comes, especially post-COVID? How have things evolved, with your personal practice, in-person dental care as opposed to, either, I don't know if there's a telehealth, teledental care, or if there's ways to do that post-COVID. Please enlighten us.
Yeah, well, during COVID, we did most offices shut down. due to a lot of restrictions. And it was also a lot of risk because, of course, we were considered the number one offenders with COVID just because we have the most aerosols out of any occupation, with the dental hygienist being the number one occupation.
Hmm.
So we have to be cautious. We had to be cautious with that. And of course, being in person, we had to have different PPEs as far as safety, goggles, gowns, whatever. And some of it I still do wear, and just because I saw how much stuff splatters in my face, so now I at least make sure I wear my shield just so my face won't be as dirty. And we did do telehealth, but it was more so just basic. Okay, describe what's going on, and you could take a picture of your mouth and let us see what's going on. And sometimes, ever since the pandemic kind of ended, then people still do that. They take pictures of their map and say, "Hey, can you tell me what's going on?" And sometimes these pictures are better than the expensive camera pictures that I pay for from a dental company. So it has evolved to technology the way
Wow.
technology, I guess, should be.
So are you saying that some of us will we get a discount on our bill if we take some pictures at home and send those in? Can we get a discount on our bill? Is that what you're saying?
It would make it go quicker. That's all.
I had to throw that one in. I had to throw that one in. What would
Yes.
what would you say are some of the most common dental issues that you see in your practice and around the city of Jackson?
Well, it's just more so extractions. Cavities, of course, is that's the number one disease amongst children, whether people knew it or not. And sometimes people just don't take care of their teeth, and then also periodontal disease is also prevalent, and it's something where you can as easily just go for a nice deep cleaning and keep a good schedule. You can stabilize it or reverse that. So it's very important that we attend to our mouth health, because sometimes it is connected to the rest of our body. Well, all the time it's connected to the rest of our body. So
Hmm.
people don't realize the importance of that, and people don't realize, just recently it was a 30-something-year-old past NFL player that died, and his thing was that dental abscesses. That was the reason for his death. So, and he was still healthy. So, it's very important. It's almost, life. It can be life threatening if you let it go too long.
Well, and I'm so glad you touched on that because that's something even in my practice of family medicine and also as when I've been a hospitalist, um, taking care of very sick and complicated people in the hospital. I think it's very important. I'm glad you highlighted that a lot of people don't see the importance of dental on your overall health. They just think of it, well, I just go to the dentist when I got a broken or chipped tooth, or when I want to get Invisalign or something like that. But it's so important, and it's unfortunate that somebody actually died because of a dental abscess. It sounded like it seeped into their bloodstream. They got septic and unfortunately passed away.
Yeah, yeah, and as a matter of fact, in Maryland, they have this thing called the Monte Driver's Law. Mainly, it's a 9-year-old. He had an abscess, and they kind of ignored it, or they wouldn't allow him to be seen because of insurance problems.
That's
So when he passed, when it finally came to a head, and he ended up dying of a brain infection. So the legislators up in Maryland, they wanted to do something to make it to where that's not the cause of death for children. They wanted to give access to care. So I think that's the biggest thing, is trying to get better access to care.
Yeah, that is absolutely unacceptable. And that's called what was the name of that law in Maryland you were saying?
I think it's Demonte's driver, because I'm thinking that's his name. And a lot of people can Google it and correct me if I'm wrong.
Okay.
Just off the top of my head, that is the name of the child that passed away.
Yeah, that's so sad. I was saying, yeah, it looks like there was a question. Our first question came in, but yeah, it looks like you answered that. It was, how does your dental health affect your overall health? And I think you just, we went into that naturally. So let us know if anybody else wants us to expound upon that, but I think you
Well,
hit that one right on the head there.
yeah, I can continue to go. It's not only linked to certain vital body parts. If you get an abscess in your dental cavity, sometimes it can cut off your breathing. Of course, if the abscess exceeds so much. And I'm sorry, I couldn't think of the word. We have a physician on the phone to correct me.
Oh yeah, it's all good.
And sometimes it can affect your heart, of course, your brain, and it's of course if you're hurting it can raise your blood pressure
Mhm.
and vice versa. Sometimes if your blood pressure is up then it can give you problems dental wise. So you just want to be careful with all aspects of your body including your dental health. We're not here just to try and take care of problems. We're here to try and prevent things from happening. And that's what I have to stress to patients, especially the ones that only come in when they're hurting. I let them know I don't want it to be a big problem and nobody's available to see you.
Yeah, absolutely, absolutely, and that kind of, I think that lets us segue into the next question that we had for you, which, and that was, how do you, from your perspective, tell when a person requires like emergent or urgent dental care that needs to be seen like stat, right now, versus somebody who can be rescheduled or put on for later, just maybe some examples of things that would lead to that.
Well, infection. Infection is the number one thing that will make me say, okay, you need to be seen and at least getting on antibiotics. And sometimes if we're not available and they say that they have an infection going on, it seems like it's swelling and it's spreading, then yes, definitely want to get that taken care of. And I may even tell them, hey, go to the after hours clinic or go to, one of these area clinics that's open on the weekends, including Sundays, and just try and at least get on antibiotics just so we can isolate that until you're able to see the proper dental provider.
Absolutely, absolutely. Looks like I think they're just kind of getting some more folks in the. And thank you all for whoever's joining there. We see a few more people have joined. Thank you all for joining Telehealth Tuesday, where we're here always on a Tuesday, 7 o'clock p.m., and we're here featuring the Dr. Deidra J. Snell, DMD, and we with the coolest glasses known to man.
Yeah,
Uh,
yes.
so thank you all for that. And please keep the questions, comments going. We are here live. We're here for you. We're talking all things dental. And so, what are some misconceptions that patients in Jackson have about visiting the dentist, would you say?
Yeah, what I just stated, you only come when you're hurting. And
Only come when you're hurting.
yes, that's the biggest misconception that I get from people, and I have to let them know how important your dental health is. Also, sometimes people get the idea of if my other health is good, I should be able to get well. They don't think that your other health has to be well in order to get dental treatment, but no, you have to have a good heart, of course, and you also have to have. Um, you have to have not I can't even think of it. But blood pressure. That's it. You have to have a decent blood pressure because they don't realize the meds that we numb you with. They only raise your blood pressure. So if your blood pressure is already elevated, then we only will elevate it even more because we have epinephrine in most of our numbing medicine. And the ones that doesn't have epinephrine, I notice that they may not work as well. And my biggest thing is I don't want people to be uncomfortable when seeing the dentist. Another thing, another misconception that may happen is fear of the unknown. Just from me dealing with kids for like primarily for 2 to 3 years, I have noticed that most of the reason that kids are scared is just the unknown, or they may have been informed by their cousin or YouTube about how the procedure will go,
Hmm.
and it's not as they think it is. So my biggest thing to make patients a little bit more comfortable is just by letting them know everything that's going to happen as it happens. And the more that you let them know what's going to happen, whether it's a bad feeling or a bad taste or even some air or water, then the more comfortable they get. So I definitely try and get it to where they are comfortable and relaxed regardless and without meds.
Hmm. Absolutely, absolutely. So we've got another question that's come in. It says, "What would you say the the best toothpaste is?"
Any toothpaste with fluoride, because
Anyway.
honest, I will grab a tube of AIM and it will work just as fine as any other thing. The fluoride is the biggest component that you want to make sure you have in your toothpaste. And I know right now we do have some, health conscious people that try and say fluoride may not be the best way, but I promise you, there's way more benefits to fluoride versus risk.
Hmm. Absolutely, absolutely. Let's say we have a couple of people here. We got some more questions coming in. Or this is a. It looks like it's a comment. I have several patients um, that come in trying. Looks this Rona Huey. I have several patients that come in trying to get their blood pressure down before they come to the dentist. After that, it's like they forget all about their blood pressure. Well, I know a thing or two about that from the primary care perspective. Um, and that's just some of the challenges of practicing in Jackson, Mississippi. And but hopefully, we are, as you said so eloquently, to educate the folks here and at large that your dental health is just as important as your overall health. So your blood pressure, your diabetes, the same way people want to come in and get checkups, they're concerned about those things. Weight loss, we need to have, as the young folks say, take that same energy and make sure we put it into our mouth.
Yes, exactly. And you spoke of diabetes, and I didn't explain that. Well, I want to expound upon that. And mainly diabetes, it makes it difficult. For example, if you're getting a tooth extracted, the extraction site doesn't heal as well if your diabetes is more uncontrolled. So we do want good glucose readings before you get your extraction, just to help with the post-op healing time. Otherwise, you'll be at higher risk for what we call dry socket. And dry socket hurts worse than a toothache. And it's mainly exposed bone. So you definitely want to try and avoid that dry socket at all costs. Yes, it does include maintaining your glucose numbers correctly.
Absolutely. Let's say we have another question that came in that said, "Are there any natural options that you recommend?" They said, "I like baking soda and peroxide. What are your thoughts on that and any other natural options?"
Well, the baking soda and peroxide, that's something that I did as a child. But I also noticed is growing up that I was sensitive to any kind of whitening product, and it is a form of whitening product, and it causes my teeth to have extra sensitivity. So therefore, I try to avoid anything that may be whitening unless it has a certain component in it. I think it's carbamide peroxide or something of that nature. But yes, we want to definitely be cautious about the risk, the benefits as well as the risk that's associated with everything. And like I said, the biggest thing that we harp upon is the fluoride, making sure you have fluoride in your toothpaste, and especially if you're at high risk for decay.
Absolutely. Excellent. Excellent. Another caller, another question here that says, "When I was growing up, students were not informed about the importance of brushing your teeth, and nothing was mentioned about flossing. Is anything being done by dentists or dental organizations to encourage young people to care for their teeth? And is there any organization that provides free dental care to students?"
All
Hmm,
right.
great question.
Yes, it is a great question. So, as far as getting exposure out about the kids and to their parents, we a Black dental organization, the National Dental Association. We started the process of Give Kids a Smile Day, but then it was picked up by so many people, and then finally the Academy, not Academy, but American Dental Association, or the ADA, they did kind of take it over and made it a nationwide push. And Give Kids a Smile Day is mainly one day, a Friday, mostly in February, where the dental schools open up to local schools and have them bust in order to get their teeth taken care of. And sometimes people go on site. Sometimes people may open their office up. But that's one big nationwide initiative that we have for trying to get the word out to kids and let them know the importance. And the Mississippi Department of Health have some resources as well where they send people out to different clinics, because I have done what we call sealants
Hmm.
on kids at school, and the sealants, it mainly help to make everything smooth on the tooth.
Hmm.
So with cavity bugs, the way I tell the kids, so cavity bugs don't want to stick, because they don't want to stick on. It's hard for them to stick on smooth surfaces
Okay.
versus smooth surfaces. So that's why it's important. If we can protect it early on, then we can prevent things from happening, or prevent a cavity just from that.
Awesome. Awesome. Another question says, why did they take fluoride out of the water in the first place, or is it still there?
The last I heard, I need to research more, but the
Mhm.
last I heard, it is in water. We're trying to get it into every aspect of water, but the only thing is, a lot of people now only drink bottled water. A lot of people are not drinking from the tap, especially here in Jackson, Mississippi, and I understand why. But it is important to get fluoride into the system, especially for those kids that may be at high risk. And when I say high risk, mainly your diet, or even if it's in your genes, because sometimes you can have people that have genes that's more of risk. They can do everything they want to brush and keep clean, and they still get cavities. And you can have some people that don't care about their mouth at all,
Hmm.
and they don't get cavities. So it's just the aspect, and it's just become scientific. It's a hydroxyapatite thing where some people have it and some people don't. And I'm a Marvel girl, so this thing Unbreakable. I don't know if you saw that movie, but that's a
Oh,
good.
right. Yeah, absolutely. With Samuel Jackson,
Yeah, yeah. So Bruce Willis was the
Bruce
one that
Willis.
was unbreakable, because he had that in his genes. He had it to where it was harder for him to break bones, and he probably had perfect teeth without even doing anything.
Oh, right, right.
Samuel L. Jackson was the so-called villain, where it seemed like he can do just barely anything and break a bone. So, yeah, it's a lot of factors that can contribute to decay, and how high at risk you are, or how much of a low risk you are.
Yeah, that was an amazing movie, by the way.
Yes, I definitely love it.
So we've got a couple of questions that have come up in our DMs, and it says, "What can individuals do to be proactive about their dental care overall?" We know that such as annual checkups. Obviously, we know that those are strongly advised, but home care regimen that you recommend if somebody just wants to be proactive about their dental care overall. Are there things that somebody could start, like say right now, a person who's got terrible gingivitis and dental caries, gum disease, and all this, and possibly be a diabetic, kind of a typical patient that we both see. Is there anything they could start, right now to be proactive?
Okay. Well, besides, of course, making an appointment to your dentist, and we try and see everybody every 6 months, just to try and once again prevent things from happening. At home care, you of course need to floss at least once a day. When I say at least, that means you could do it more. Just make sure that you're doing a minimum of one time. And the flossing itself, if you get the old fashioned floss, then it could wrap around those teeth pretty well, and you have to floss on both sides of either tooth, whether it's a tooth next to it or not, because sometimes the plaque build up and that sometimes turn into calculus, or the soft stuff that sometimes solidifies or calcifies, it can get onto those teeth, and you just want to make sure you're getting everything good and clean. So flossing at least once a day, brushing at least twice a day. And when you're brushing, just make sure you're doing a 45, well, we say 45-degree angle mainly. Just make sure the bristles are getting in between the teeth and the gums because that's where things like to hide, especially if you do have gingivitis or periodontitis. And anytime you hear the word perio, that's related to the gum. So you want to try and make sure that all of that is taken care of. And then you also can brush your tongue. A lot of people don't realize that because there's some bacteria on the tongue that you can get rid of or decrease the amount just by brushing the tongue. And it makes your breath smell even fresh. uh, and of course, rinsing. Now, which order it doesn't matter. I don't. It's been a big debate about what to do first, but just do it. That's all. That's all we want.
Yeah, well, I think you had us at fresh breath. I said, if anybody didn't hear anything else that you said there, that is halitosis is a no. So I think that please to help your community, and let's do that, please. Um, let's see, we got a comment here. My teeth and mouth feel so much better using my water pick. Dr. Snell, what are your thoughts on the water pick? And do you feel like this is also a mixture of my personal question? Do you feel like the water pick is an acceptable substitute for actual good old fashioned floss and getting around the teeth manually?
All right. Well, I would say that it is a good substitute, but research also has shown that it can be almost is equivalent to flossing with the good old traditional floss, string floss, and for me, it feels like I get a better clean whenever I have that string floss wrapped around my teeth and getting things out that way. But the water pick definitely is a great alternative, especially those people that have braces.
Hmm. Absolutely. And we appreciate all the comments. And again, we are live here. All questions and comments we appreciate. Please don't hesitate and don't ask all at once. We appreciate the questions and comments that we've gotten so far. We'll go back to some of the ones that we prepared for you with our show. The next thing I wanted to ask you, could you help to walk us through a typical patient experience for you? Like, when they open that front door on Ridgewood Road over in North Jackson, when they come in and they're greeted by your staff, just take us through a typical patient experience when they come to your office.
Now, first off, when they call, we try and make sure that they feel the love through the phone. You have to smile while you're talking. So,
Okay. Can you say that one more time for the
you have
people
to
in the
feel
back?
the love through the phone. So if you smile while talking, then at that point, they feel that love. You have to show everybody that they are just as important as the next, and give everybody care, and you'll get care back, of course. And is for we want you to call, make the appointment, and even if you call and don't get anybody, it automatically texts back because we know that's the new age right now. Everybody wants to text. So we try and get the forms to you ahead of time. We can text them to you. That way you can already have your forms filled out so you won't have to worry about, coming in 15 minutes ahead of time so that you can fill out your forms. But if you just so
Mhm.
happen to have to come in and fill it out yourself, then you're welcome to do that. We have both options available. But as soon as you walk through the door, you greet it. We make sure that we become familiar with our patient. We like to call them by their name, and we sometimes we like to know little facts that's going on with them, so we can have something relatable. And as soon as you get back, as soon as you're being called back, and people don't realize that we break it off into hygiene or cleanings only, and treatment to where it's mostly me doing fillings or crowns or dentures or whatever it is that's on my list.
Mhm.
So just because you come in at the same time and somebody get called before you that came in after you, it may not be like that. One may be hygiene and one may be treatment. So that's a big
Mm,
misconception in dentistry. So,
yeah. Uh,
so
I'm really glad you touched on that because I know a lot of patients when they come in to my office, and sometimes they'll say, well, well, they won't say it, but you can read it in their face and their body language, and they say, well, wait a minute, this person came after me, and they're being seen, and like you say, we have this a three, it's a we have a multi-tiered, multifaceted practice, so two physicians and a chiropractor, and so sometimes, especially on Tuesday and Thursdays when she's in the office, some people could be coming in to get adjustments and different therapies going on, and so they might come after you and they go right to the back. So yeah, you don't really know what's going on. So I'm glad you helped to clear that up. We
oh
appreciate it.
yes, yes, but
Let's
yeah.
talk about. Oh, go ahead. I'm sorry. Go ahead.
No, you can go ahead.
What about any specific challenges that you face? Do you feel that there are any challenges specific to being in this region, especially specifically Mississippi, Jackson, Mississippi, as composed to practicing dentistry other places? When I read through your bio, we know that you've been all over. You've been to India. You've been to Maryland. You've studied at UMC. You and additional facilities. So what would you say that the extra challenges are that you face being here as composed to all these other uh, places you've been?
Well, sometimes the challenge, of course, will be cavities because of the diet. Sometimes the cheaper stuff or more affordable options for eating is not the healthiest, especially for our teeth. It's a lot of sugary things that's uh, like that. And look, I love candy myself, but the important thing is making sure that you're taking care of yourself after you eat the candy. Are you brushing or are you eating it and going to bed and letting it marinate overnight? So, in Mississippi is just one of the things that I would like to have change is Medicaid. Right now, Medicaid only pays for extractions for adults. For kids, they take care of pretty much everything, but for adults, they only pay for extractions. And of course, it's going to encourage more people. Hey, let me just get it pulled. But people don't realize that the more you get your natural teeth pulled, the more difficult it is to function because you're not able to chew like you can. You can still replace it. You can replace it with an implant if you want to, but the implant still doesn't have as much strength as your natural tooth. Even if you have a root canal, there's still a lot of more strength. So I encourage everybody to try and save their teeth if possible.
Mm. Well, and I'm so glad you talked about that because I don't. Well, I won't say who the person is that has dental implants, but this particular person who's close to me has. Well, I know she got four on one side, and three on the other. Um, and that was it was kind of a two-part thing. The oral surgeon placed the implants, and then the cosmetic dentist would come and put the crowns on. And for those that are listening, the crowns are the white part, the part that you can see, the part that you chew with. And so yeah, the fact that you just touched on what you said, I'm glad that was very appropriate because a lot of people, it seems that people are going all over the place. Matter of fact, let's touch on that. A lot of people are going to different countries, whether it's Mexico or wherever they're going, DR, and they're getting these package deals. Not sure if even these dental providers are licensed or what the deal is, but they're going and getting a package deal, and so and some are even going, say if they're going to get something done, BBLs and all that kind of stuff. Then other people are getting a mouthful of veneers, and we wanted to know. Oh, and actually, there's a question coming in that what are the pros and cons of these veneers, and then does that cause bad breath when you get veneers? So I know it's kind of multifaceted. So to kind of sum it up, number one is, what are your thoughts on veneers, and is it safe to go abroad and get these procedures? The other thing is a person has one of our callers has asked, then does it make your breath smell bad and cause halitosis when you get veneers?
All right. So as far as going out of the country for a more affordable smile. I don't encourage that mainly because you're gonna have some. Most of the time, you have post-op problems. And if you have mainly after you get everything done, you will have like soreness, swelling, things that may need to be attended to. And sometimes when you get those veneers or you get anytime you have a tooth cut or prepped or anything, then you're putting it at risk for the nerve not surviving. If the nerve dies out, then at that point you're gonna need a root canal. And it's just so much harder to do follow up with somebody that's so many miles away because what would you do? Fly down there but if you see one of us afterwards, it's a case of we have to start over. So we try and encourage everything that's related to the American Dental Association's acceptance versus other countries because we know that that will be best for you. And as far as getting halitosis, anything, I normally tell everybody this: any orifice that has odor, any orifice of your body that has an odor, you probably need to get it checked out because it's most likely related to something.
Wow. I think we need to rewind on that. Can you say that again, loud and clear, for the people in the back?
Yeah, so any orifice on your body that has any kind of bad smell, you want to get it checked because it's most likely related to some type of infection.
Hmm. Well, I appreciate you reinforcing that because we try to tell our patients that all the time, and that brings me to my next thing, my next point, and my question. A lot of times we say, well, when I'm looking at a patient doing an annual exam, we say, open up and say, a lot of times we may or may not use the tongue depressor. And for those that are watching, that it's the thing that looks like a popsicle stick and push down your tongue and all that. And then the doctor looks in. And a lot of times, especially here in Mississippi, we'll see a lot of people with missing teeth, terrible gum disease, all this stuff. And they say that, man, I'm just so, they'll say either they don't have insurance to go see the dentist, or but the bigger concern that they tell me is that, oh my gosh, I'm so worried about going. I know I got these cavities. They're gonna drill all in my mouth. I'm gonna be hurting. And so the question is, what are some of the steps you can take to ensure control of a patient's anxiety, to comfort them so that they to quell this misunderstanding and fear about going to the dentist? Are there any things that maybe your staff will tell the patient, or are there any treatment options or modalities that you can do to help them through this so that they don't feel so much anxiety, they don't feel so much pain during whatever procedure that they may have?
Yes, as I stated earlier, a lot of times the fear of dentists is fear of the unknown. So letting them know anything that we can possibly tell them over the phone ahead of time,
Mm-hmm.
or any ways to prepare, that's best. Sometimes people take medicine for anxiety, and we encourage you if you're nervous and you want to be able to relax some at the dentist, just take those medicines that's already prescribed to you to help you out and make sure that you have somebody along with you to drive you in case you're affected by the medicines and not able to drive. So, and when we bring them back, we talk to them as much as possible. We try and get them relaxed. But my number one thing before I even get started on a patient that I see is anxious is asking them what made you anxious. What is it that I need to try and avoid doing it so I won't trigger anything, especially
Mm-hmm.
if it's something from your past experiences. So yeah, I just try and avoid those things that may make them feel bad. And sometimes I try to avoid even saying needle. Yeah, I just say the N word, not just say the other N word. And sometimes I try and avoid saying blood because sometimes that could be a trigger. And some misconception they have, but I still don't do it, I guess, is wearing red scrubs. And they
Really?
red can make people think of blood. I don't know. And then also white coat syndrome. You've heard of that
Oh yeah,
plenty of times because
absolutely.
yeah, I try to avoid wearing a white coat in the clinic. I only wear it when I want to kind of look official, like now. And,
That's right.
and so I just try to relax them as much as possible to where they can feel comfortable over time. Because we've had some people that come in very nervous about a root canal because there's so many misconceptions.
Mhm.
But once we get started, then we'll eventually have them to where they're snoring in the chair, and I say, "Thank you. I can brag on you now."
Do you, and speaking of snoring in the chair, so is that uh, the laughing gas, as a lot of people think of? Is that still a practice that's used in dentistry today, where you give the mask and apply the laughing gas, the nitric oxide? From what I know, correct me if I'm wrong. Is that something that you utilize often in your practice?
We don't have it available right now
Okay.
because sometimes it may add extra steps to it.
Hmm.
So what I can do is I normally refer out if it's somebody that needs sedation, but a lot of
Okay.
times people that need sedation or think they need sedation, they can eventually relax. But if I see that there is too much for them, I don't want to take them too fast. So I just go ahead and get them to the proper person because the important thing with dentistry is it doesn't matter who does it. I just want it done. I want. There's so many people that's avoiding the dentist altogether. So if it's somebody else that if we're not a good fit for you, then I just want you to be with somebody, even if it's me hooking them up with a dentist. So yeah, that's it.
Okay, okay, that's good to know. And then kind of piggybacking on that, when it comes to deadening the nerves and numbing folks up, we get a lot of people that that's another concern that they have. They say, well, man, I don't want my face to be drooping like those people in the movies and all of that. Do you feel that like, so when a patient's face is drooping in that way and they're slurring, they can't drink out of a straw? A lot of people laugh at, they find that funny. Is that, is it just dependent on the actual patient, like how they respond to the anesthetic? Or is it that sometimes if you require so much to make you numb, is it kind of dose dependent, like that's why people's face ends up drooping when they have a procedure and stuff?
Yeah, well, of course, we're numbing the nerve, so therefore you're not innervated, you're not able to control your muscles like you normally can. So that's where sometimes the droop come from, but it
Mhm.
doesn't supposed to be long lasting. But when I do numb people, I let them know, whether verbally or on the paper or on the informed consent, we say that hey, your numbness it can last for hours, weeks, months, or sometime permanently, which I hadn't seen a permanent one yet. But those are things that we tell you worst case scenarios, but we hope that everything gets back to normal as soon as possible. And some people take more than others. My thing is when I have to numb a person up so much, I I say first thing I say is I bet you can hold a lot of liquor, huh?
Oh yeah.
Yeah, yeah, it's hard for me to get drunk. Okay, I see why. But their
Oh,
metabolism is pretty much high. So
yeah.
that's why sometimes we may have to numb a little quicker or we have to work quickly after we numb
Hmm.
because it can become regular again. So it's important to get the numbing medicine, of course, to get you as comfortable as possible. And speaking of trying to get the numbing medicine to work, sometimes you can have an infection that will cause our numbing medicine not to work as well, which is why most some dentists actually, when they see a person with swelling, they just go ahead and give them meds and tell them to return a couple days, just because it'll make it easier for a person to be numb. Because I'm one of those dentists,
Okay.
I'm not going to work on you if you're uncomfortable, because I don't want to be in nobody's nightmares. I only want to be in dreams.
You want to? I like. Did you came? Is that original? You
Yeah,
came up with that one. That's
yeah,
original.
that's original.
I like that one. You say I don't want to be in nobody's nightmares, only in the dreams. All right. We've got another question that's come up. Does everyone have to get their wisdom teeth removed at some point.
No. If it's not giving you a problem, if it's not open to possibly cause infection, sometimes you can have a small opening where things can get in there and cause infection. And if it has room enough to grow in, you just leave them alone. Like grandma say, let dead dogs lie. If it's not bothering you, you don't bother it. But
Mm,
sometimes if we see people at risk, then yeah, we get that taken care of. And military, oddly enough, I've been doing military events on and off for since 2007 while I was still in dental school. And military make everybody get their molars or wisdom teeth extracted because they want them to
really?
be what we call deployable, are able to go at a minutes drop, and they have to have make sure they don't have any dental problems that can happen within 6 to 12 months in case that's how long they're deployed.
Really?
And I don't know if that's still the standard now, but that
Yeah,
definitely was the standard back when I first started doing those military events and trying to make them deployable.
that's that's amazing. I never would have never would have thought of that. I'm sure a lot of people listening and watching, they probably didn't think that one either. Let's you know what? Let's change gears and talk about the rural setting of Mississippi. Is there anything set in place to provide care for the folks in these small towns in Mississippi? Do you work with anybody with that, or do you personally go to any of these types of places to provide care?
Well, I'm from a small town myself where the population of the town is probably like 1,000, and the population of the county is probably 3,000. So, and and down in Port Gibson, I did practice at the community health center there for about 3 years, and I enjoyed, working with the people that I grew up with, or people that I looked up to all my life, or even the new ones coming along. So that I had a different passion down there, and thank God some of them have still followed me up here and found me, even with the name change. They found me, and we still have a good patient dental provider relationship.
Mm,
So yeah, the biggest thing is it's hard to get dentists to go to those areas. They tried to put in a rural health scholarship in place to
right,
try and
right.
encourage dentists and physicians to go to those areas where it's little to no access. Because when I was down in Port Gibson, it was the next dentist was probably 20, 30 minutes away. And one time I had a patient say, well, we don't have gas enough to go there. So, you have to look at those realities. Everybody can't
Yeah.
come to a big city or, can't travel far due to restrictions. So we just have to try and make it accessible and encourage people to go, especially if there's areas where you can practice. And a lot of people don't know it may be a gold mine because nobody's there. So, especially if you have a good thing going and you're giving good quality care, it's amazing how many people you can get to come from the big city and come to the small town because that did happen some while I was down in Port Gibson.
Mm, well, that's amazing. You know what? Let's talk about the role of dental insurance. What would you say the role of dental insurance is? Um, in the care of your patients, because I know that with us in primary care, Medicare, you got Medicare A and B and D and all this kind of stuff. It gets really complicated. Um, and usually with jobs, I know that the dental and the vision plan is usually not as kind of convoluted. You just you got it's like either you want the dental coverage or not. Either you want the vision or not. So, what role does the dental insurance play in things, and how do you or your staff, how do you guys help patients navigate that?
Yeah, and I'm glad you said help them out because one thing that a lot of patients don't realize is looking up your insurance is not really our responsibility. It's
Mm. Oh,
yeah.
all
So
right.
if
Okay.
you want to know the truth, thing, you have to research it yourself, and we just try and help people out by looking up the things
There you
that
go.
happen. And then sometimes you may have little measures in place where insurance may not cover certain things for certain reasons. And of course, the cost is passed over to our patients, so they don't realize, that. And some patients really don't realize how hard it is to have dental insurances to pay the claim. Just flat out pay for it because it was done. Because they try and fight tooth and nail, no pun intended,
Yeah.
for not paying. So the I love cash patients, patients that where you don't have any in between, and then sometimes you can have it where you get the work done and you can pay full price it and then go to dental insurances yourself. Some people actually do that.
Mhm.
So, but we try and make the transition as comfortable as possible for our patients to where they can have an estimate. Everything that we give is an estimate until insurance pays for it. Then sometimes you may get a final bill. Sometimes
Mhm.
you may get a credit. So, we try and make sure that we do all we can to help that patient out and to get insurance to cover it for them.
Okay, absolutely. And then, when it comes to gum, we all talk about gum disease, gingivitis. Maybe if you could just help us understand and help the audience understand, what gingivitis or gum disease, like, what is that, and what is it caused by? And reason why we asked that question. Um, Recently there was a group of people talking, and they were, discussing. They were saying, well, and actually, one person's daughter is in pageantry, and so she was being taught to smile a different way because of the appearance of her gums. Or other people were taught that, saying, well, if your gums are pink, this and that. If they're black, and I guess maybe quote unquote unsightly, that, does that, so basically the color of the, does that mean that a person is stricken with gum disease? Do you see that on the outside in the color of their gum, or can that just be hereditary? And what is gum disease?
All right. So the blackness sometimes of your gum or multicolors is it related to something you and I can relate to. It's the melanin. Sometimes it changes the gum color. So,
There we go.
embrace that. That's okay. Everybody gum's not meant to be pink. So
I hope
embrace.
y'all heard that. I hope y'all, I'm sorry. I hope y'all heard that.
Yes. So the same way we embrace our skin in its different tones, we want you to embrace your gums in different tones, but also make sure that you go and ensure there's nothing wrong with them. Uh, Whether your gums pink or multicolor or black, you want to make sure that nothing's wrong with them. And as far as gingivitis, periodontitis, everything starts off with gingivitis, where gingivitis mainly is irritation of the gum. Anytime you hear the itis, that's related to inflammation. So
Hmm.
what you have is plaque on your teeth that can build up over time. Plaque is the stuff that you can scrape off with your finger and kind of see underneath your fingernail. Back in the days
Oh,
we used to
man.
say butter on your teeth.
But
So
yeah.
sometimes if you allow that butter to stay on your teeth, then it can calcify and harden and turn into what we call calculus or tartar buildup. Now that
Mm,
calculus or tartar buildup is not as easy to get off your teeth, yeah, with a floss and toothbrush as it is for you to get the plaque off your teeth. So that's why we encourage you to get as much plaque off your teeth if is possible, because otherwise you'll have to go to the dentist and we'll have to use our professional instruments to either scrape them or blast it off to where you're nice and clean. Now,
mm,
sometimes when you get into periodontal disease or periodontitis, that's when you lose attachment. If you see people that have very, very loose teeth, they most likely have been
mm,
experiencing periodontal disease.
mm,
And the irritants mainly are there. And it's responds to plaque and calculus buildup the same way that any part of your body will respond to a foreign object. Kind of like I have to explain if you get a splinter in your finger,
Right.
How will your body react? It'll get red, puffiness, swelling, bleeding. Some people say I don't like to floss because I bleed when I floss. Yeah, the more that you floss, the less you bleed. You get rid of the things that's making it bleed, and it's tender to touch. So in order to get that relief from that area of the splinter, you remove the splinter and then you get relief. So that's the same way that I say with uh, things that's on your teeth, the plaque and the calculus and the tartar. You want to remove that in order so you can get that relief and your gums can get healthy. Now, sometimes periodontal disease also can contribute. It can be hereditary, and in that case, you still want to see your dentist, and sometimes you may have to be seen more than just 6 months, every 6 months. Sometimes you have 3 month recalls, sometimes you have 4 month recalls. It's based on how your health is in between your cleanings. And the better your health is, the further out you can go without a cleaning and get back to hopefully regular 6 month recall. And you have early stage periodontitis. I think they changed the classifications of it now, but the early stages after gingivitis or irritation of the gums, you still have your bone underneath that's attached, but eventually you may get to this point. If it's on there long enough, it may start eating away at the bone, or you may lose some bone or attachment loss. And anytime you losing a bone underneath, then you have what is formed pockets around your teeth. And pockets mainly the same way on your pants pockets you can hide stuff. That's the same way that it can happen with your mouth. Is that you can hide things into those pockets of gums around your teeth, and that can cause even more irritation until like eventually your teeth are literally falling out. And I hate to see people pass that point, especially if they don't have decay, because that is the case. A lot of times you won't have decay, but you have periodontal disease, or vice versa. You have a lot of decay, but no gum disease. So,
Mm.
and it's just, I don't know why it's like that, but and they both have different bugs that are the cause of them. So I guess those bugs can't coexist sometimes. I
Right.
don't know. That's just me talking.
Right. 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 Okay. Well,
Yeah.
I know we're getting close to the end of our program here. I saw a comment come in. We had someone who's saying they were saying hi, Dr. Snell. Um, Dawn Weddington there. Appreciate
Oh,
you
he
joining.
said he's our chiropractor. My
Yeah,
home girl from Fort Gibson. We used to ride
yeah,
the bus together, and then she's a chiropractor, so I'm very proud of her.
yeah, yeah, absolutely. Um, so, we had, if anybody else has any questions before we go, I will take one more question if one more comes in. Otherwise, I had two or three more, but we won't get to all those. But the main one that I wanted to ask you is, what is your ultimately your vision for the future of dentistry in the city of Jackson, in uh, the Metro Jackson area, and especially when it comes to improving the in-person dental experience, like just where do you see that, what is your vision for that?
Yeah, my vision is making sure that people see that you need to invest in your mouth as much as you invest in anything else, and you will get that return on your investment. Teeth are important, and the more you have, the better you are. And just mainly where they're doing as much as possible to save their teeth versus, hey, just go ahead and get it out. Because some people believe, hey, let me just get all my teeth snatched out and let me get dentures. But you're definitely going to complain then, because your bone's only going to keep on shrinking, and then the denture won't be able to be worn, and you'll have to get some aid with that. So, and access to care. And earlier, somebody asked about free uh, care. I, I
Oh, right.
Tuition First does have a clinic that's ran by the dental students. I wish they would have had it while I was in dental school, because I love doing things like that.
Wow. Okay.
But I think they only have clinics on one Saturday a month at least. So that's one thing that's available, and I would like more things available for those people that can't be seen. And sometimes we have seen people that get donated dental services, which is a national program where there are so many dentists, so many dental labs, and so many partnerships where a person who is in need, who may have a lot of health complications and just can't afford it, they can get services through those providers.
Hmm. Absolutely. Absolutely. Well, we appreciate you mentioning those resources. And this, we want to thank you, Dr. Snell. We want to thank you for joining us here on Telehealth Tuesday. Before we go, um, please tell us what's going on with you, anything upcoming in the community. For first of all, if you don't mind, let us know, what your where your practice is, the name of it. If you want to just tell us anything, any exciting updates or anything you're doing in the community, the floor is yours.
All right. So my practice is Ridgewood Smiles Dentistry, located in Jackson, Mississippi, on the corner of Ridgewood and Beasley Atkins, across from the Chevron station, or I say back way to the mall. That's what we used to say back in the days. And we provide as much dental care as we possibly can. And we also have some great resources when it's kind of beyond our reach, or when we see that somebody else can kind of team up with us to get your dental needs addressed. And I also just took on the position of dental director with the Hinds County Detention Center.
Okay.
Uh, so I actually love, I've been thinking about prison dentistry since my last year in dental school. And it's just always been off and on, but I've been interviewed twice because it is a population that also needs to be taken care of. And know that we care just for you all just as much as we care about anybody else. I tell everybody, don't treat me how you want to be treated. Treat me how you would treat the mother that you're so in love with, or the father that you're so much in love with. That's how I want you to treat me. Because of course, we do a little extra for our parents compared to what we'll do for ourselves, or we'll do a little extra for our kids.
That's
So
right.
so yes, I am enjoying going there twice a month or so is needed, and of course I go on my mission trips with Salt and Light Ministry, and that's always in the summertime. It's 1 week, and that's a ministry that's year round. It's different churches. I love the aspect of Salt and Light Ministry mainly because there's several different churches in the Jackson and surrounding areas that get together to meet a need. And it's far away, of course, in Honduras, and they have an actual clinic set up there. And now they're getting into doing operating there, and we have dentists down there year round. So, and as I say, we send teams down there from different churches as they want to. We just try and assist them as much as possible to make it a smooth transition for them and their team. So that's one of the things that I really love is just giving back. Ultimately they say whatever you're willing to do for free, that's where your passion is.
Absolutely.
So dentistry is definitely my passion because after I get done, I would like to just continue to do mission trips and everything like that because they very much appreciate it. And sometimes people say, "Hey, it's missions right here at home." Yes, it is, but it's wherever you call. Sometimes you're called to be close. Sometimes you're called to be far away. But that's between you and your guy. It's a relationship thing. So
That's
whatever
right.
speaks to you, that's what you do. Just go for it.
That's right. Absolutely. Well, again, we really appreciate that. And we had a couple of comments that came in. One person said we enjoyed listening. This has been very informative. And we also had, that's my line brother right there. That's Pastor Cordell Fields. Thank you guys for making such a positive impact on our communities. And there you go, Cordell. There you go, brother. That's the tail right there. Good to see you, man. Appreciate you all joining in. Thank you, everyone, for watching, being with us here at Telehealth Tuesday, where we're always here, always on a Tuesday. Next week, we will feature our very own Senator John Horn, and also Miss Angie Young, who is a Medicare expert, and we will be there talking about Medicare Matters. You don't want to miss that because we know that Medicare can be so convoluted. I know Dr. Snell has seen it her practice, and especially in primary care, we definitely have seen it. And so please, everyone, tell your church members, please circulate this. Go to Dr. B TV on YouTube, Good Faith Wellness Center, Instagram, and also Facebook. Circulate this everywhere. This is something that our community doesn't want to miss. If you missed this episode, you can go to Dr. B TV on YouTube, spell out the word DOCTOR, B as in boy TV, where you can see this. You can see us here, Telehealth Tuesday, all of our episodes, and of course, including this one, which will be uploaded literally right now, featuring Dr. Snell. And also quickly upcoming, we'll see a WAPT News exclusive where I treated the patient. We gave an experimental. It was the first time this particular medication was given to this patient who had COVID back in 2020, who basically everyone left for dead. And so this woman is certainly not dead. She is here, and you will see that on WAPT News. We'll release that when it's all edited and when the news channel drops that, but you don't want to miss that exciting and informative interview. So God willing, again, we will see you next Tuesday at 7 p.m., always on a Tuesday. And remember, true wealth begins with good health. Bye for now.
All right, bye.
Hello, I'm Dr. Michael Bookhardt. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today. And remember, true wealth begins with good health. Hello, I'm Dr. Michael Bookhardt. Come join us at our newest clinic location